It's
No, no,
okay.
no issues.
Okay, so we are live now. All right. I'll just introduce you guys briefly. I think people already know about what good work you're doing in Pakistan and UK, but I'll just briefly introduce you guys. We have Dr. Amir Ali Thakur, who is a graduate of batch 2 and is a consultant emergency department uh, at St. Mary's Hospital, Isle of Wight, NHS UK Trust. And then we have Dr. Sana Zehra, who's a graduate of Batch 3, and she is currently working in the emergency department of as a registrar at Kingston Hospital, London. And we have Dr. Sama Mukhtar from Batch 6, who is a consultant emergency medicine at the Indus Hospital, Karachi. And I believe all of you are taking, since you frontliners, you're all taking care of the COVID patient right now. I would like each of you to briefly, very briefly, introduce yourself and what kind of work you're doing at your respective institute. Amir, can you go ahead with it?
Okay, so I'm working as a consultant emergency department. You already mentioned at Isle of Wight NHS Trust. Um, I've been in UK. I came to UK in 2005, and since then I've been working in different areas in UK, in mainly in London, then Birmingham, then Scarborough area, and now in Isle of Wight. So last 3 years I've been working as a consultant in the emergency department. I'm also a lead in the major trauma. So we are dealing with major trauma patients,
Okay.
and I'm the lead in the major trauma, and also I'm the department lead in for the ultrasound as well, and also the educational lead for the non-trainees, especially those who are doing Caesar program in the UK. So I'm the lead for my hospital in at Isle of Wight. So whoever is doing non-training, I'm the point of care for their teaching. So this is just a brief
All
intro for
right.
myself.
All right. Okay. Sana, can you please tell us about yourself?
So I have recently moved to UK. We moved end of November, and I've joined Kingston Hospital, which is southwest London. It's Surrey, and I'm working as emergency registrar here in Kingston Hospital. So the work mainly deals with, of course, as any emergency department. Currently, with regards to COVID situation, it's more about dealing with COVID patients. How do we attend them as the front force, and how do we direct them in terms of care management, initial management, or further advancing towards inpatient. So, as of now, briefly, this is about it.
Okay. And Sama, please.
Hello, everybody. Good to be here on the show. I'm Sama Mukhtar. I'm a graduate at Bat 6, and I'm working as a consultant in emergency medicine at the Indus Hospital, Karachi. As of now, I'm a member of the Corona Task Force at our hospital, and we are actively involved in the emergency response for COVID-19 in Karachi.
Okay. Dr. Amir, can you please elaborate about the COVID situation and how are you manage patients there at your particular hospital in UK? We know that like UK has topped the list in COVID patients, so I would like your you know uh,
Second, yeah.
अच्छा, सबसे पहले थैंक यू हुदा एंड फाइन के आप लोगों ने एक तो यू डन एन अमेजिंग जॉब ये जो है प्लेटफॉर्म यू क्रिएटेड दिस प्लेटफॉर्म. Secondly, I would like to thank my faculty, especially Professor Ijaz Vora, Dr. Irfan Ahmad Khan, or Dr. Amir Umair, Dr. Iqbal. I don't know how many people know about Dr. Iqbal. He was the professor of pediatrics. He was one of my inspiration.
yes.
One more thing. One of our colleagues has passed away, Salman Sartar Sheikh from batch two. He was suffering from cancer.
Yeah.
This was last year, but I just want to remember him as my friend. He was our colleague as well. So I just wanted to give, may Allah Pak grant him Jannatul Firdaus.
Amir.
सिचुएशन इन यूके जो आपने this is as you know कि UK is now in the number two league after US. In US, you know, it is 70. US has crossed 78,000 deaths, and UK is about 31,000. It has crossed 31,000 mark, and we've got around 212,000 positive patients. So we are second in the world after the US. Situation has been very grim, and the hospital has been rammed up with COVID patients,
Yeah.
especially in parts in London, Birmingham, Manchester. Situation has been very grim, and I think Sana would be telling much better about the situation in London. My hospital is about 1.5 hour from London. It's a small island with a population of 150,000 patients. We've got around 150 COVID positive patients. So, Alhamdulillah, it's not too bad in Isle of Wight, but still, we are getting a lot of COVID positive or those patients who are coming with respiratory symptoms. So, there have been the ITU have been full. They have been busy with these patients, and so the situation at the moment is quite tough now. But what I've seen is in the last week or so, my assumption, or you can say because the number of patients that are coming, the number of new patients have decreased. We've got lots of patients who are in ITU and they are sick, and it's the same as in other parts of the UK as well. There are lots of deaths because lots of patients who are already on the ventilator now they are passing away. So the number of deaths is corresponding to those patients who have been there for 2 weeks or something. But the number of new patients have decreased, and I'm not saying they've completely gone, but still we're getting a lot of patients. But relatively, we have crossed the peak, and we are now in the plateau phase, and hopefully, inshallah, in the next couple of weeks, we will be in the declining phase. So I'm hoping in the next maybe in the next 2 3 months situation is going to be get quite a bit better, but looking at things, if people are not going to follow the guidelines or the whatever we might see another wave of COVID again. So I'm hoping inshallah it won't happen.
Yeah.
So this is the
So,
situation.
probably the reason for the plateau is lockdown. Sana, would you like to briefly talk about the lockdown and the situation, and what are the steps that you're taking in UK with respect to that?
Yes, I agree. The plateau has come mainly because of people following the lockdown rules. And from 23rd March onwards, the lockdown was taken up by UK and then extended by from mid-April further. Um, we are actually expecting lockdown to somewhat ease off from Monday onwards, but let's see how they would proceed towards it. So what our hospital did, so my hospital is a 600 bed hospital. In emergency, we have around 55 beds at one time that we treat for patients. We have a recess of around 10 beds, pediatric recess separate. So when this COVID crisis pandemic started, and as the cases kept on ramping up in UK as well, before the lockdown, what our hospital did was that our emergency department was split into respiratory and non-respiratory. So that way, we were able to contain the respiratory or the infectious cases away from the non-respiratory or the non-infectious cases altogether across the hospital as well. So that is how we started to contain. Initially, we were not testing the patients who were walking in with symptoms of COVID. So addressing them at triage and counseling them, educating them about how to take care, how to prevent, and further on, we used to, without testing initially, send them back home and with safety netting. Now, later on, what we did was testing was increasingly started, and now we are testing all the patients who are coming up with symptoms and all the inpatients as well, elderly patients as well. So that way we are able to further track up the number of positive cases. Earlier we had less number of cases because we are not testing enough number of people over there. And yes, the plateau has come up, and we do have less number of patients coming in, but yes, the complications are more or less still the same as Dr. Thakur said. And the higher number of death in UK, one reason has importantly been the elderly population. We have large number of care homes with elderly population with multiple comorbidities, which is why we have a very high number of mortality. Yeah. Yes, Huda.
Okay. Okay. I just have one request to all three of you. If you can please mute the sound of because it's echoing. I don't know when you guys are speaking, it's echoing, so it's like bad for your ears. So, okay. So, Sama, can you please give us an update, kind of like what is the situation like in Pakistan?
Okay, so from the Pakistan perspective, we had our first case reported in Karachi and Islamabad on the 26th of February 2020. And from then there was this rise in the
Huh?
cases. Should I continue?
Sama, your sound is very clear. There's no issue.
Okay, so from
It's
26th
echoing.
of
Somebody
February,
has their yeah, yeah.
mine is on, I powered off my phone totally. So on the 26th of February, we had the first two cases reported from Karachi and Islamabad. And after that, slowly and gradually, the COVID positive patients started pouring in. But we saw an upsurge in March and April when we had Zaireen, who had come back to Pakistan. And since they went in a mass gathering and we have no records how many people went, how many came back, but a lot of them contracted the disease from Iran and then it spread further. Similarly, the religious gathering that we have in Punjab, we had a lot of patients from that, again, uncontrolled. The surge was in March and April. If you open the government statistics of Pakistan, you see that there is a surge in the graph in April. After that, we started having local transmission. So now when we screen the patients, asking them if they've had history of international travel is quite irrelevant now because there is a massive local transmission now. Initially, when the lockdown happened in Pakistan,
Yeah.
it was curbed and things started looking as they'll get better. But since the lockdown has eased up a bit, we are expecting a rise.
Yeah.
If I tell you the latest statistics that I went through, especially for today's session, as of today on the Government of Pakistan website, we have a total of 24,474 cases. And in the past 24 hours, we've had 1,600 cases, which is the biggest reported number in a day, which is as of yesterday 1,600 cases, and we've had 618 deaths, which is a mortality rate of 2.2% right now. And we're expecting that this is going to rise because of the economic fall in Pakistan. Imposing the lockdown is probably not feasible for the economy. So we are yet to reach the peak. And if I talk about the provinces, Punjab is taking the lead with 10,471 cases and Sindh 9,691 cases. And following that is KPK with 4,300, and then Balochistan, Islamabad, Gilgit-Baltistan, and Azad Jammu and Kashmir. We
Yeah. The
initially we did
maximum.
not have a lot of testing kits.
Yeah.
So the tests were limited. Initially, when this COVID spread, people were just walking into the emergency just because they had a headache or a flu or fever and they wanted to be tested. And not everybody was being tested, and we were trying to educate people to quarantine themselves for 14 days at home. But now the testing capabilities of major hospitals, I can speak for Karachi, has increased, and we are testing at a bigger rate than we were before in mid-April. And if I talk provincially, the largest number of testing right now is being done in Sindh and in Punjab. very few testing being done in Gilgit-Baltistan and Balochistan. So we really don't know the number of cases there. If we don't increase the testing in those areas, we might see a bigger uphill rise. But the peak in Pakistan is yet to come. Some speculate around end of May, beginning June. Yes.
That is been offline now.
So, Dr. Thakur, how are you testing patients? Do you have a criteria, or you are just have increased the testing capability at your hospital?
Acha, this is an interesting question because what we were doing, we have been testing those patients who were very unwell. Not all patients were coming with the symptoms of having, as you were saying, okay, jo bhi nazla, flu, or these symptoms, they're coming with flu and flu-like symptoms. They're not getting the test. So we've got another, we've made, there's another area in our hospital that is meant for testing the local population who we are suspecting if they think they've got any concerns about having a COVID-19 or corona-like symptoms. They call 111 and then they will guide them whether they need test or not. So from our side, we are testing only those patients who are really unwell or who really need admission. So apart from that, from the emergency department, we're not testing everybody who's coming to the department or everybody who is concerned about having a COVID-19. Secondly, I would just like to inform my viewers. I think everybody in the world they put their own plans about treating the COVID-19. So what we have planned, and I think in UK or in other parts in US or even in this hospital in Europe, you probably would make a plan of how to deal with these patients. So we've got two EDs now. We've divided our emergency department into a hot and cold area. So hot areas for those patients who are COVID-19 suspected patients, and they go into that area. The other cold area is those patients who are like any other patient, not related to the COVID. So it can be chest pains, it could be something else or whatever. Now we've got two recess as well. So it's a hot recess which is meant for the COVID-19 patient, and a cold recess which is meant for any other recess. So all patients who need ventilation are we have made a plan that they will be only intubated by the anesthetic and ICU team, regardless of whatever they've got. So, and in the cold areas, if we need it, so it can be done by the whoever the good experience, it can be done by the emergency physicians or whoever is capable of doing that. But hot areas only done by anesthetic, and so this is how we are managing the patient. So once we get any call from the triple line, so they will alert us as a COVID alert. So that will be on the red phone. They will say it's a COVID alert. This patient is coming, whatever the complaint is, and we take them into the hot area, and then we treat them exactly as we are treating the sepsis patient. If we are getting a patient, so we've got one more thing about the cardiac arrest, and especially in this COVID time. So if we've got a COVID cardiac arrest, then we will be alerted that this is a COVID cardiac arrest, and the same we will be doing. Once we are putting out an emergency call in the hospital about cardiac arrest, and we'll put a COVID cardiac arrest in hot recess, so exactly they will know where the patient is going. If we say that it's a non-COVID cardiac arrest in cold recess, so they will know where exactly the patient is going. So there's some difference in the ALS protocol, not major difference, but little bit that we are in the hot area. We've got doctors and nurses who will stay there for 4 to 6 hours, or some of the nurses are staying there for 8 to 12 hours even. So they are in there with people bond, and for 6 hours they don't come out of that area. Whatever the rest, whatever they will deal with it. Once they finish with that, only then, once they've completed the 6 hour shift, they will come out of that and then they can move on to the other areas. So early defibrillation, and the other thing is the most important thing in this time, because we are rammed up with these patients, we don't have spaces in the ITU. So we are keeping a low threshold in making a DNAR for these patients. So anyone above the age of 65 with any mortality, we are keeping a very low threshold, putting making early DNA CPR. And if we know that patients who are unwell, I go personally make sure that each and every patient has a DNR in situ. If they don't have, then we make sure that they get one. So this is a brief about how we manage the COVID-19 in our hospital. I think probably
It's more or
Sana
less
or
quite similar here as well. But here in Kingston or in the Southwest London area, so as government policy, they keep on announcing the new policies, trying to increase the number of tests, which is the main reason, the main way out to contain the disease, as what South Korea and Germany did, other than social distancing and isolation and quarantine. And the reason how they were able to contain the disease was because of exponential increase in testing. So this is what the government plans are as well. They plan to do antibody testing, which is the serology testing, in which we test the general population if they have been infected or not. So for those people who are non-medical, seeing the program, so antibody test is a test which detects if you have had COVID infection. It may be mild, it may have come up just like any seasonal flu. Like most of the COVID patients, 80% of them would go away with mild symptoms, 15% would get into severe, and 5% of those who would require intubation, ventilation, and poor chances of survival. So the government is trying to test these patients through this antibody or serology testing. This test kits would are expected to be available from end of May in most of the labs, and by end of June they're expecting to rise up the test into general population in a count of millions. That is the only targeted way through which we can actually definitely with a surety ease of the lockdown. That is the only way through which we can surely say that okay, we are able to contain the disease. We are aware that this much of population has already developed immunity. So what we do in a serology test is we check the antibodies. So it's a quick test which can easily be done like a pregnancy test. So just a pin needle stick prick, and you get the blood sample into the kit. And within a time of 10 to 20 minutes, you get positive sample if it is positive. If you have had corona already, it would show antibody, either IgG or IgM. So this way, the government would get to know if the population, a larger scale of population, has already been exposed to COVID and has developed immunity against it or not. So this is the plan for now. But for corona, since the virus is new, COVID-19, we are still yet to see for how long would this immunity sustain, because when SARS came in 2003, 2002, and 2003, people were tested to have retained immunity against this virus for quite a longer time. Whereas in case of corona patients, certain private companies and private labs were testing antibodies, and they found that those patients who were tested positive for COVID did not show any antibody. So it's either that the antibody tests kits were not completely reliable ones, equally sensitive ones, or maybe they do not develop a long-term immunity against it. So this would be quite a turning point if the immunity is short-lasting or long-lasting one.
So, if I may ask, are you still doing the PCR?
Yes, we are.
And
So
how
yes, we
long
this
are.
does that take?
as of now on a larger scale is mainly doing PCR. PCR is the test, the nasopharyngeal swab, which is being taken. The antigen and antibody tests are all in the pipeline, not being done at a larger level. We are still doing PCR through which we are diagnosing the COVID patients.
And how long does the report take?
So
So
it takes about 48 to 72 hours for the PCR to come back. In certain hospitals, like in Isle of Wight, because we are a bit further away from the central zone, so we send the sample to the main areas, which is in Southampton or London. So we might get about in 3 to 4 days. But normally it takes about 2 days, 48 hours for the result to come
48
back.
hours is the usual turn up time in which we get the result. Though there are
And
kits that can give the results in 10 to 15 minutes, but yes, here for now, this is the earliest turning time.
So, here in Pakistan, Pakistan, I can speak for my hospital, the Indus Hospital. We're doing the PCR, and PCR, our PCR takes 12 hours to 48 hours. But by 12 to 24 hours, we usually do get the result. And because Indus is a charity hospital, it's a free of cost service, and it's a private organization which is providing free of cost service, and very good service, I must say. So we have a lot of surge of patients. We have a huge population coming to us. Those who, especially because you have the poor and the needy, and they want good quality care, and Alhamdulillah, our hospital is able to provide it. So we have a lot of patients coming to the emergency. I'd say we've had like a 40-45% rise in the emergency visits, and to triage all of them, so we have formed, when this started, our emergency departments first of all started a screening desk. So every patient that visits the emergency, after going to the family medicine clinic, they first triage there. That is at the gate. They triage the patients over there. The ones who need to go to the ER or are COVID related come to the screening desk of the ER. And over there, we take their histories. And we have really tightened our screening now. And we are testing more patients. Initially, we were not, because of the kits were less, but now we are testing more, because with the Pakistani population, you literally have to tell them that you're sick. You are sick and you can die, because they just don't listen. They are resilient. People are not serious about this disease. They're not taking social distancing seriously. They're not taking the lockdown seriously. So we need to tell them that they have a disease and they can give it to others. So our testing capabilities have increased. We are testing people. We are testing contacts. We have divided our emergency, just like you, Dr. Sana, and Dr. Thakur, your hospital. We have divided our emergency into a respiratory and a non-respiratory one. Immediately after the COVID outbreak, in the beginning, only we had the negative suctioning system installed in our respiratory ER, so that the microorganisms can be filtered out. So we have that. We have, mashallah, alhamdulillah, we have proper protective equipment for the doctors. So doctors are secure in that respect. In the respiratory ER, we have a resus bay, which is usually 5-bedded, limited beds, but we are hoping and we are striving to provide. We are considering all sick patients as COVID. For us, at this point, every patient is considered COVID, because we cannot risk spreading the disease here. Because lack of education on behalf of people, a lack of social distancing. So for us, and because of limited space in the emergency as well, even in the non-respiratory we are on high alert for COVID. We will not walk around over there without N95 at least. And we always have this, I give this patient may be COVID. And as soon as we think that there's a suspicion of COVID, if there's something in the history, and we definitely do an X-ray. If the X-ray is suggestive, we take it as COVID until it is proven otherwise. And every patient we are packed to the brim. We are usually fully occupied, to which point we say that there are not enough ventilators in Pakistan. The hospitals that are providing for COVID, we have very few ventilators. And even if 20% of the population of Karachi gets affected by this and needs the ventilator, I'm very sorry, we will have to come to the point when we will have to take a decision who needs the vent and who should be let go. Which also brings me to the point that, of course, like Dr. Thakur said, 60 plus, DNAR is the option because of the limited capacity. We have to save the younger people, but we've seen really, really bad cases. Especially in the elderly, of course, with other comorbids, and even in the young. we're
Mm,
seeing pretty bad cases and we're packed to the brim. So,
mm,
social distancing and even more emphasis on continuing the lockdown further. I see
mm.
that the government is easing the lockdown because of the economic fall, but it's really going to be a catastrophe for Pakistan. It will be.
It would be the same even over here. I'm sure Dr. Thakur would also agree. So, yes, this would definitely be a message from this platform that even if the government is easing off the lockdown here or any place in the world, kindly continue with the lockdown. Make sure that you don't go out of your houses if not needed, because there would be a second surge which would rather be worse than the first one, and that would still be really difficult to contain, because until now, despite getting into the plateau phase here, we don't have a definite treatment. Yes, we are going through different recovery trials using steroids, using anti-malarial chloroquine or antibiotic azithromycin, or even the HIV medication or strong anti-inflammatory, the immunosuppressants. Still, none of them has been definitely proven to be taken as the treatment of COVID. So, if anyone asks right now, do we now have a treatment for COVID? The answer is no. Do we have a vaccine for COVID? The answer is no. And if you go through the statistics and if you go through the studies as how CDC develops uh, vaccines for any kind of infection, the usual turnaround time for a vaccine to come for a population, to be used for a population, is around 10 years. And here we are targeting to get the vaccine in the next 1.5 year. But again, as we see every other day, we get a news about different strains of viruses and the different spike proteins which are showing resistance. So earlier I was reading about the three strains of coronavirus, and then we say further mutation. Then we came across 19. Then another study from China, it showed more than 30 strains. So the more strains we have, it means, what we mean by that is there's specific protein or the antigen in the virus that keeps on changing its genetic form, which is why if we need to target a vaccine to target that protein, each time we need to develop a new kind of vaccine to target that new mutated protein. So, as of now, if you ask, we don't have a vaccine, we don't have a treatment. So, people should still not hurry. Even if lockdown eases off, there is no need to go out of your houses, no need to go for social gatherings like a small party, no need to go and meet your friends and family. If you want me to be secure, kindly stay in your house. Please take this as, as a take message. It's extremely
Okay,
essential.
we getting few questions as well. I think there is a someone has asked what precautions should we take while we are doing our grocery. So, uh, anyone wants to answer? Sama or Sana, do you want to answer that?
If I may, for Pakistan at least, because people are not practicing uh, the government orders of continuing with the lockdowns. The grocery stores are open here till 5 o'clock. As of now, I think from Monday it will ease down further. Please, if you have to go for groceries, khandan ko na leke jaएं. One person should go and wear a surgical mask, a three-layered surgical mask. And if you may, you can wear gloves. Keep a sanitizer with you. Try to go to grocery stores that are less crowded and choose your time earlier hours. I think the rush will be less. और जो खुले स्टोर्स होते हैं जिनमें हवा की क्रॉस वेंटिलेशन होती है is a better idea than stores in malls. And of course, if you touch surfaces, sanitize your hands, get your stuff, um, use a card, preferably not use cash. You might leave COVID germs on that. Come home and at least I practice that I change my clothes, wash my hands. I do that and I take my shoes off at the entrance of the house.
So
My
yes,
go-out shoes are separate.
we can discuss about what preventive measures do we as doctors take in day-to-day life. How do we try to and struggle with protecting our family, the people who are immediately living here with us? So yes, going to the hospital, getting into donning the PPEs, So if I'm assigned to a respiratory major, the respiratory zone where we see other than COVID, all the respiratory kind of cases, we need to consider them as COVID. So we, other than the gown, we do the visor, we do N95 or FFP3 mask, and of course gloves and apron that we keep on changing with every patient. Repeatedly, hand hygiene means each time soap and water, generously washing the hands, and then changing gloves with each patient. Once your shift is over, you are preferably asked to take shower at hospital, or otherwise you need to change your clothes, get home, ask the family to stay away from you right away, go take shower, change, put the clothes back into washing, and then only you are coming to sit with your family. Again,
Yes.
sitting with the family, you need to maintain a certain distance, though it is considered that once people, any one of the members, if affected in the family, everyone is expected to be COVID positive or exposed to COVID. But still, it is not an easy job to stay away from your family. You know, you need to keep a distance with your children, from your children. You need to keep a distance in, like, staying in the rooms, not sharing the blankets and all that. So, guys, please be extra careful, extra vigilant about all these steps that you need to take at yourself. The
Just want to add.
responsibility the individual has. Yes, yes, Dr. Thakur.
Yeah, just wanted to add one more thing for all NHS staff. Sana, you would be knowing, Sainsbury, Tesco, they are giving, they've got a protected time for 1 hour time where only NHS staff is going and shopping there. So make use of that time, all the NHS staff and their families, if you've got, go at that time. And whenever I've been there, they have been very, very appreciative, given me a lot of gifts and clappings to all the staff, not only me. And so this is one of the best things that you can do. Go at that time when you can, to avoid rush hours and things like that. There is one more question regarding there's a Amira Shah who's asked any clue why South Asians are more susceptible in UK as mortality amount in Pakistani healthcare professional is high in the UK. So Sana, would you like to, or do you want me to answer it first? It's okay.
You proceed with the answer first, please.
Okay. So this is about the BAME doctors, what we call as BAME doctors. This is the Black and Asian minority ethnic group, which is more susceptible for death in the COVID-19, especially in the UK. So there have been 3 studies done. One was in the Oxford, and the data has been taken from the ONS, which is the National Statistic organization. It's a completely independent statistician company which measures all the data. So they've taken a data of about 12,500 people, and in the 12,500 deaths in the UK out of the 31,000 deaths that have been taken place. What they found is largely unexplained reason why the BAME doctors or why the minority ethnics are dying more. But the factors they've mentioned is because of the more comorbidities in the Asian population and the Black population. We are more diabetics. We don't care, look after ourselves. We've got very sedentary lifestyle. So that is one of the factors they mentioned. The other is the socioeconomic less advantage, socioeconomic, generally speaking, not in doctors, but generally speaking in the Asian and minority ethnics, it's the low socioeconomic. So these are one of the few factors they have mentioned, but largely it is unexplained. There were a lot of concerns from the NHS as well. Now they have taken up the issue, and the NHS, the chief medical officer has taken the issue, and they are thinking about removing the Asian doctors, the minority ethnics, from the front line. We are yet to see how they are planning about this, but because there are a lot of concern, and there have been 8 Pakistani doctors who have died. So I know personally lots of my friends who are on the ventilators, who are very sick at the moment. They have been admitted. So there is a lot of concern in the BAME doctors, in the Asian minority ethnic group. We've got lots of concerns. But now the government has taken up the PPEs, and now we are getting a very good personal protective equipment. So from that perspective, we are happy with that. But still, the death rate is still quite high. So out of all the deaths in the doctor, what I've seen is there's very few white doctors who have died. Mainly the minority ethnics. There was one study that has been done from, I don't know where the study was done, but it came up in one of the leading newspapers in the Guardian in UK. What they mentioned is it is because the minority ethnic they have not been provided the proper PPE at the start as compared to the white counterpart. So that's why they have concluded that it is possible that because they have not been listened to very well earlier in the when it started, and when most of the doctors were saying about the PPEs, and especially the BAME doctors, the Asian minority ethnic, they weren't provided with the proper PPEs. That's why it has caused a lot of death in the minorities.
Are you saying, Dr. Thakur, that the Asian doctors were not given proper PPE? That's like racism.
No, 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 no. I think that's
Sorry,
not.
Sama, I can't.
I'm saying,
I think
are you
I can't hear
actually
you.
saying that the Asian doctors were not given PPEs?
No, it wasn't. It wasn't. But if you what I've just read the study in one of the newspapers, they found that personally, if my experience, I've been working in like I had no problems in the PP. Whatever PP I was getting, the same my white counterpart was getting the same PPs. So it wasn't any different. But there have been some studies now. What they are telling is that it might be because of the Asian doctors haven't been provided with. So not in my experience, but this is what the few of the studies have been showing that it might be one of the reasons. So I'm not sure exactly which hospital they are talking about. Have they generalized it? But not in my experience. Even not in the experience of my friends or colleagues who are working in the UK. I haven't heard anything about like that, but this is what the studies are showing. There is a possibility that the minority ethnics have not been provided the proper PPEs, but this is not specified whether they've taken this from certain hospital or somebody. So I'm not exactly sure about which hospital they have mentioned, but this is the generalized population. That's what been in the study.
What is your Asana? What is your experience like in your ER?
My experience has been completely neutral, regardless of being white or non-white. So,
Hmm.
me being, I'm type 1 diabetic, so my lead consultant from ED, she made sure when this COVID story completely started and our departments were made to split, she made sure that as much as possible, I am posted in the non-respiratory side just to be sure that
Less
I'm,
effective. Yeah.
yes, I'm completely safe. If at all, once in a while, I am in respiratory side, I am being offered, I am being asked to take. Actually, there's no need of offer. You are being asked to be taking complete PPE regardless, because I don't think this is logical. Because PP is not just about your protection. If you are not protected and you are carrying the virus, you are infecting the patients as well.
Yeah. Yeah.
There is a specific room for complete PPE. If you are entering the respiratory majors, you need to just go into that room, don in complete PPE, and then come and sit here. Sit in the respiratory major. So it's regardless. If at all, the consultant sees that any of the PPEs, like many times, visor, people are relaxed with visor, not taking visor when going to the respiratory research, or the mask is not done properly, if at all, for anybody. The consultants will make sure, point them out. But otherwise, I have not seen any discrimination at all. I would rather, actually, I was really appreciating that my consultant took this step. Otherwise, if they had asked me that you need to equally work, we are providing you with all PPE, I wouldn't have really said anything. But they
Yeah.
really make sure that all people are taken care of very well.
Yeah.
Any
So, Sama, can you tell us about your experience? How are you dealing with the upsurge being in the ER while you have limited bed availability? How are you coping with that?
It's very tough. It's very nerve wracking because we are at a complete lock. we have limited beds in the emergency to cater to
Yeah.
these patients. And trust me, we have sick patients coming in, and
Yeah.
sometimes we have to say that we don't have any beds to give you any service. So, with the lockdown easing, the numbers are rising. Our beds in this emergency are packed to capacity, and
Yeah.
so are the beds in the COVID unit, which have ventilators to each bed. They are also packed to capacity. We literally have to. It's a sorry state, but we have to wait that okay, so there is a potential expiry. So we hang on to a patient who may be admitted on that bed.
Okay.
It is a sad situation,
Yeah.
and sometimes we have to keep the patient in for like in the emergency for almost 24 hours until a bed is arranged, because if a patient is COVID positive and if the patient is sick, and if our hospital does not have any beds in the COVID unit, we have a network framed by the government of Sindh
Yeah.
in which all the major stakeholder hospitals are interlinked, and we
Okay.
have contacts of all the stakeholders in these hospitals, and we call them up and ask them if they have any beds, and we make sure we arrange a bed for that patient and make a safe transfer in a proper ambulance with COVID protection, PPE protection of the staff in that ambulance, and the patient is safely transferred out. So no patient is referred out from any hospital in Karachi without proper transferring services. But if this continues, I can't say how it's going to be. With the beds being full in SIUT, in Jinnah, in Dow, Liari General Hospital, these are the main, and Khan. Most of them are full, and the patients keep pouring in, and it's very difficult for emergency doctors because we are supposed to give immediate relief to the patient, treat the patient, and then send the patient off to the respective department or the ward or the unit. But whereas now we are actually working as wards because we're keeping the patient for 24 hours,
Yeah.
maybe even 48 hours at times. So it's like we're working in a ward quite literally.
Mm.
And somebody asked, RK, is the testing done free of cost at the Indus Hospital? Yes, the test is absolutely free of cost. The treatment given at the Indus Hospital is absolutely free of cost.
And what are the tests that you are offering? Like, what type of tests are you offering?
We offer a nasopharyngeal swab, which is a PCR
Yeah.
test for novel coronavirus. The report
Okay.
takes 12 hours minimum, and can go up to 48 hours also. But between 12 to 24 hours, we do tend to get the
You get
reports.
the results. Okay.
Mm.
Yeah.
Here, I would
All
like
right.
to
And
add
what
a
about?
point,
Yeah.
Huda, sorry for the interruption.
Yeah.
So many people are asking if they had the symptoms, yet the test was found to be negative. So the PCR, nasopharyngeal swab. So here, I would like to add that the test is more of operator dependent. It's like who takes the
Exactly.
swab and
Yeah.
how it is taken. So this test is more relevant to finding if you definitely are positive for COVID. If it turns out to be negative while you are having symptoms of flu, you need to consider yourself as COVID and do all the isolation and precaution measures. Not to consider yourself that you have a green signal to move out and spread the infection. We had a question here.
I just wanted to add.
Yes,
Sorry, go
Yeah.
on, Sana.
uh, no, please carry on. Then after that, I'll continue with the question we came here.
Okay, I just wanted to add one thing, as Sana mentioned, like if the sensitivity for the RT-PCR is about 50 to 75%, which means like 25 to 50% of the patient can still be negative, and they are false negative patients. And it can be dependent on the operator. There are other factors as well, but still the sensitivity is 50 to 75%. So there's a huge window that we are missing on those patients who are positive, but they are actually false negatives. So what the WHO guidelines say is if you're suspecting a patient who has symptoms of COVID and they've got a RT-PCR negative, You repeat the test in 24 hours, minimum of 24 hours. And if the second test is negative, then you can just say the patient that he's negative and you can take them off the isolation or the quarantine. So this is the World Health Organization guidelines. So after the second test, you can take them off the isolation. But as Sana mentioned, in UK, what we are doing is once the patient is negative and we are thinking they've got positive signs, then what we ask them to isolate them for at least a week from the time of onset of symptoms, or if they are quarantining, then it should be at least 14 days.
Yes.
We are doing the same. We're following the WHO guidelines also. Again, like Dr. Thakur said, that 50 to 70% is the negative rate for the PCR. But again, swabs from both the nostrils is important, and of course, the technique is important. We here in Pakistan consider the symptomatology very important. We consider the history very important, and we consider the X-ray as well.
Yeah.
And then again, the test. If the test is negative, history is suggestive, and the X-ray is suggestive, we will of course repeat the test before 24 hours, and we will consider the patient COVID positive.
Here in UK, what we are doing is, since a large number of population is coming now to ED, even other than calling 999 or 111, they do directly come as well. So what we do is at triage, we'll talk to them. Okay, if they have respiratory symptoms, fever, cough, sore throat, flu. Uh, but if their saturations are not falling below 95, if they are maintaining that, we would guide them with safety netting and let them go home. If we think there is a superimposed bacterial infection, yes, we would prescribe them with antibiotics as well. But we would let them go home, and if at all they feel any breathing difficulty, then they are always asked to return. But we don't right away X-ray all the patients if they have simple flu-like features and maintaining saturations above 95. We are just safety netting and advising them isolation and just social distancing at home. That is it. And the question that appeared here, probably Sama would also be able to add much to it. The question was that why is it that the people in Pakistan are not taking social distancing and the advice that all is being said about COVID as seriously as the world and the health
Yeah.
organizations are emphasizing on? So yes, Sama,
I
you
think Sama
started
would
and
figure
then
that.
we'll continue. Yes.
Well, why people are not taking it seriously? Because I think with the Pakistani mindset, people don't want to accept the truth. They want to live in their own world, and they want to live in a nice merry-go-round world and not face the facts. And they have not come to terms with the fact that COVID has hit Pakistan. It has hit it bad, and we have yet to reach the peak. And again,
Yeah.
जब तक लॉकडाउन बहुत टाइट था, पुलिस भी आपको नजर आ रही थी सड़कों पे, काफी स्ट्रिक्ट थी. Even I had to be stopped at multiple spots by the police, and I
Yeah.
had to tell them, I've come back from the hospital, let me go. But आहिस्ता आहिस्ता पुलिस भी उनका भी हल्का
Weary
हाथ हो
okay.
गया है, वो भी सड़कों पे नहीं रोक रहे. आप बाजार जाए, रश पागलों वाला रश है बाजारों के अंदर. ग्रोसरी लेने लोग इस तरह निकले हैं जैसे ईद की शॉपिंग के लिए निकले हुए हैं. So I guess they just don't want to accept the reality, and I'm sorry, when it's going to hit us really hard, only then maybe they'll understand. और दूसरी चीज ये है कि
Yeah.
आप लोगों का यूके का सिस्टम होता होगा, आई एम श्योर इंश्योरेंस होती होगी, कोई गवर्नमेंट के रिलीफ्स होते होंगे. यहाँ वो सब नहीं है. तो डेली वेजेस सफर कर रहा है, बिजनेसमैन सफर कर रहे हैं, लोगों के पास खाने पीने को नहीं है, जिसकी वजह से पाकिस्तान में अभी चोरियां बढ़ गई हैं, डकैतियां बढ़ रही हैं. People are facing security issues because people are hungry, there is poverty. तो उस वजह से गवर्नमेंट ने भी लॉकडाउन थोड़ा ईज करना शुरू कर दिया है, और उसकी वजह से अब वो कहाँ से जो प्रैक्टिस करना चाहेगा भी सोशल डिस्टेंसिंग और इस डिजीज को सीरियसली लेना चाहेगा, वो भी नहीं ले सकेगा, क्योंकि कोई आ जाएगा, कोई उसको छींकेगा, कोई उसके ऊपर खांसेगा. आप पढ़े लिखी फैमिली में देख लें, लोग इस बात को मानने को तैयार नहीं है. दूसरी बात यह है कि मीडिया के ऊपर से लोगों का एतबार काफी हटा हुआ है. we generally think that Pakistani media बहुत hype create करता है, मसाला लगाता है चीजों को, and that's why people don't want to follow the media, क्योंकि वो बहुत लोग ये समझते हैं कि मीडिया फजूल में hype create कर रहा है। मीडिया जरूर hype create करता है, मगर जो हकीकत है वो हकीकत है। डॉक्टरों की बात सुने, गवर्नमेंट ऑफिशियल्स की बात सुने, और प्रैक्टिस करें, और अगर लॉकडाउन होता भी है तब भी घरों में बैठे।
बिल्कुल, और मीडिया के साथ
Sama,
डॉक्टर्स के इतने वीडियोस आ रहे हैं, सॉरी हुदा, यस आई वांटेड टू ऐड टू इट कि डॉक्टर्स के इतने वीडियोस आ रहे हैं जहां डॉक्टर्स फ्रंट लाइन पे या आईटीयूज में काम कर रहे हैं और परेशान हैं कि जो सर्ज ऑफ पेशेंट्स आ रहा है और सोशल गैदरिंग्स और रिलीजियस गैदरिंग्स को कंटिन्यू किया जा रहा है। तो वी नीड टू अंडरस्टैंड, हमें पाकिस्तान में ये चीज समझने की जरूरत है कि इस वक्त जरूरत क्या है, डॉक्टर क्या कह रहा है आप उस चीज को सुनिए, हर चीज को अपने कन्वीनियंस के हिसाब से ना लेके चलिए। डॉक्टर कह रहा है डिस्टेंस मेंटेन करो, आप एज एन इंडिविजुअल सिर्फ डॉक्टर को सब कुछ नहीं, सारी जिम्मेदारी डॉक्टर की नहीं आती है। यहाँ 80% जिम्मेदारी एक आम इंसान की आती है। वो हर वो आम इंसान जो सुन रहा है कि प्लीज आप अपनी तरफ से इस बीमारी को कंटेन करने के लिए जो कर सकते हैं वो करें। आप अननेसेसरीली बाहर मत जाएं, आप सोशलाइज मत करें।
I just want to add, sorry, just want to add the same thing. In Pakistan, whatever any doctors or the government official, no matter whatever we tell them, it's not going to matter anything. People are going to still going to go out. They will do all their work, whatever they have to do, they will do it. So it's a very complicated system in Pakistan, unlike in UK, because people are, or in the West, not only in UK, in other parts in Europe or Australia, and other parts. People are sensible enough to stay at home. Not everybody, but still, as a large population, are sensible. If you tell them this is a risk, this involves, so they understand what you're telling them. But if in Pakistan, as someone mentioned, whatever you tell them, it's not going to change anything. People are going to go out. It will continue. The number of cases will rise till the point when it goes completely out of hand, and then people will realize, okay, now we can't do anything. So as everybody has mentioned, we can't emphasize more on social distancing, keeping everybody at home. But I don't think so. This will be followed in Pakistan.
But
Sama, while we're at it, can you tell me about what do you think is the transmission potential and severity of COVID in Pakistan per se?
Well, I don't have the stats for it, but there is definitely a lot of local transmission. And we're seeing a lot of severe cases, and severe cases in Pakistan. Definitely, they're presenting in the elderly who are probably immunocompromised or have other diseases. But I'm seeing a lot of patients in their 40s with very bad X-rays, and it's literally taking them three and a half weeks to wean off the ventilator because their lungs are so badly affected. And we're seeing a lot of compared to females. अगर आप stats देखें तो पाकिस्तान में males are more affected again because the males have to go out to probably earn. Buses में rickshaw drivers they're males, तो males के अंदर ज़्यादा नजर आ रहा है as compared to female. And again आपकी comorbidity ज़्यादा हो तो severity भी ज़्यादा होती है.
And Sana, what are the? Have you seen any number of non-COVID patients? Has the number gone down in the emergency, or it's stable, or has it gone up now, or something like that?
so with
What?
regards to severity, Huda, it does remain the same. But yes, the number of hospital visits has somewhat come down, but not to a very significant level. Number of deaths जो इस वक्त ज्यादा हो रही हैं वो they are more in care homes because of course age and comorbids and terminally ill patients. But yes, people are following the precautionary measures, and it's the lockdown effect that has taken up. लेकिन पाकिस्तान में, as Dr. Sama was saying, कि जब सब कुछ हाथों से बाहर निकल जाएगा, then people would realize. But then I'm sure it would be very, very late. If the few things we can probably learn, you take example of your neighboring country, India. I've seen कि लॉकडाउन कैसा है, पुलिस डंडे मारती है जो बाहर
Yes,
निकलता है during
true,
lockdown.
true.
Nobody dares come out of the house, step out of the house. I think our government needs to take some strong steps like these. People are there who are socially supporting a huge population in terms of खाना provide करने the basic necessities. Even Pakistan में भी NGOs बहुत large level scale पे काम कर रहे हैं. I know it doesn't completely meet the requirement, but to some extent, all those people who are out for shopping, who are out for religious or social gatherings, they definitely are responsible. आप अगर poor population को छोड़ दें जिनको कमाने के लिए निकलना है, what about those? What answers do these people have who are out for Eid shopping or grocery shopping or just out for socializing? And considering this as just a random flu, a random seasonal flu, and not taking things and precautions seriously. They are responsible for spoiling the for spreading the disease across the nation.
I just
If
wanted
I
to
may,
add.
Yes.
up बात करें Dr. Thakur.
Just wanted to add कि according to the Royal College of Emergency Medicine की जो figures आए हैं, जब ये COVID-19 when it was on the peak, we had 30 to 35% attendances, lower attendances as compared to the normal time. अब ये attendances, they are coming back again because the number of COVID patients are reducing and other patients are coming up. So लेकिन जो है 30 to 35% of the patients were not coming up. उसमें the problem was has been a huge risk of patients who are having MIs and strokes. And I've seen patients who had a stroke who came after 10 or 12 hours because he was very concerned about that he might get COVID if he comes to the hospital. By the time he came to the hospital, the whole side was completely paralyzed. It started with a slurred speech. He was diabetic. He was like he had all the comorbidities. So started just with the slurred speech, and then gradually progressed to him completely being paralyzed on the left side. So the concern is anybody who has got the problem, they should visit the hospital because there's a stigma now. Don't visit the hospital, and because I've been in touch with lots of my families and non-medical personnel, and they are not going to the hospital. And even if I tell them to go to the hospital, they think I'm not going to the hospital because I can catch. But they are dying of MIs and they are dying of strokes. And so there's a study which has showed that about 8,000 patients have died. These are non-COVID related deaths, and this is out of the hospital. So somebody, I'm not sure exactly what is the what figure they've mentioned, like how many MIs or how many strokes, but there have been 8,000 deaths out of
General.
hospital,
Yeah.
non-COVID related deaths. So this is one of the important points that we have to mention that anybody who needs hospital, they should be visiting hospital, unless if it's not an emergency, then they should stay at home.
Yeah.
Dr. Sama, you wanted to add something?
Yeah. Sama, you wanted to add something?
So there are 2 points I'd like to emphasize on. I think people in Pakistan would know, and just for people from outside Pakistan, I'd just like to emphasize that when Ramadan was about to begin, four or five doctors, senior doctors of Pakistan, they had to do a press conference to convince the government that religious gatherings should be curbed in Ramadan because वो एक गढ़ बन जाएंगी disease को propagate करने के लिए. And we really had, there was a lot of distress amongst doctors that if these religious gatherings during Ramadan continue the way they were last year, we would have an upsurge. And we really had to convince the government to continue with the lockdown and stop these gatherings. And that did happen. Alhamdulillah, government put a restriction on the gatherings. So, थोड़ा limitation हुई है. But जो हालात चल रहे हैं अब लॉकडाउन ईज होने से फिर ये numbers अब मजीद सर्च करेंगे. And for us Pakistanis, I think it's just I might sound very grim, and but it'll be the survival of the fittest for us.
True. Dr. Thakur, have you noticed have you made any changes in the ALS protocol in the suspected or confirmed patient of COVID?
Yes, I think Oda missed that part. What we are doing is that there are certain changes in the ALS protocol, especially
Okay.
when we are getting the alert, we are getting a COVID alert. So if there is an emergency call from the paramedics, they will say it's a COVID alert, COVID cardiac arrest coming in. Now we have
Okay.
divided our emergency department into two components. We have got a cold area and a hot area. So
Hmm.
any hot area, it's the respiratory. All the respiratory patients are going into the respiratory area, and if there's any cardiac arrest coming in, then we've got certain protocol that if the doctors who are in the hot recess, they are gone for 6 hours, so they are in with full PPE. With cardiac arrest, if they come in with a cardiac arrest, what we do is we put out a call for COVID cardiac arrest, and there are certain changes that we've got, like we do, if we think that the patient is above 65, we've got certain comorbidities, we keep a very low threshold in doing a DNR. So this is one of the things that has changed. Because previously, if we are in doubt, we would make a plan and think about it, double check, make sure that everything is all right. But now we've got a very low threshold. So anybody above 65 with comorbidities, we just put them on DNR. And the other thing is the PPE. So now the Research Council UK has said if you're not properly dressed up, like you don't have the proper PPEs, you shouldn't be doing the CPR on those patients. You shouldn't until somebody who comes up with a proper PPE. So even if the patient comes in and you're not properly you haven't got the proper PPE, the guidelines say you should wear the proper PPEs and then start doing the chest
And
compression
then
because
start,
of the
yeah.
the other thing about the mask, so for all cardiac arrest patients, it should be an AGP PPE, that is the aerosol generating procedures. PPE we should be wearing. So that includes FFP3, 2 or 3 layered gowns and gloves and eye protection. And the other thing is keeping early defibrillation. If we think this patient has got, they need to be early defibrillated rather than waiting for chest compression. So just start with the defibrillation, chest compression.
Okay.
And the other thing is no mouth to mouth breathing, which we normally don't do it, but this is the new guidelines, no mouth to mouth breathing. And no, nothing. No, so if we have to recognize the cardiac arrest, we shouldn't be going close to the patient, listening to the respiration or anything. We just look at the patient and just have a quick feel of the pulse, whether they've got a pulse or not, and then we declare whether it's a cardiac arrest or not. We don't do much and we don't go very close to the patient. So there are few changes that have been made up by the Research Council UK, and most of the things, the medication, rest of the things are the same. Defibrillating, the same shock, the joules, and everything is the same. But certain protocols like early DNR, oxygen, and all these things, few minor changes have been made up.
Okay. All right. Somebody asked about immunity and some parts of the world that have stronger immunity due to BCG vaccine and stuff. Sana, would you like to shed some light on that? Is it like does it protect against COVID or severity of COVID, or is it just a myth?
Well, as far as studies are concerned, we don't have a definite study as of now. People do have different beliefs that, okay, in India and Pakistan, despite not following the proper social distancing and guidelines which are being advised, people are still not getting as infected as they would be otherwise in rest of the world, which is true. But the studies are still being conducted as to what is the immunity, what kind of immunity they have, or what role is their immunity playing. But still, nobody is, since it's not yet been scientifically proven, it is still advisable to maintain the social distancing and the preventive measures, because one who gets infected, one who gets affected, we have no idea who would get into severe form of COVID, regardless of having a healthy life earlier or being a young age person. Like day before yesterday, we had a young, healthy guy of age of 20, not having any comorbidity. He presented with flared up COVID symptoms, and day before yesterday he further deteriorated, and CT scan when it was done was showing um, abscess into the lung cavity other than
Mm.
flared up COVID. So yes, people are getting into different kind of complications as well. So as of now, considering if Pakistanis or the Asian population do have immunity, which is better than the rest of the world, I think this should
Mm.
not be taken into account. This
Yeah.
should take into account what facts and figures you have. You have an illness which does not have a cure, and you are not even sure if you have that specific magic immunity within yourself,
Yeah.
being of an
Yeah.
Asian origin or not. So I think it is not advisable to take that risk. It's always advised. It's good to be safe than sorry, because it would just
Yeah.
be
Yeah.
total end if somebody gets a bad COVID. Yes.
Yeah. Following up on that, Sama, I would like you to, address the misconceptions and disbeliefs that people have about COVID, the government as well as people, the misconceptions, disbeliefs
Yeah, we
that they
were
have.
talking about, see, most of the population, the general population, हमारे आम लोग यही समझते हैं कि अच्छा एक हल्का फुल्का वायरल है, हम कहते हैं वायरल है, फ्लू की तरह के
Yeah.
सिम्टम्स है। तो इसमें एक बड़ी इंपॉर्टेंट चीज ये है स्टैटिस्टिक्स वाइज कि नॉर्मल फ्लू जो इन्फ्लुएंजा जो सीजनल फ्लू या कॉमन कोल्ड हम जिसे कहते हैं उसकी मोर्टेलिटी यानी कि डेथ रेट है 0.1%, लेस देन 0.1%। वेरएज कोविड का अभी तक आया है डेथ रेट ऑफ अप टू 3 to 4%। तो इससे आप
Hmm.
अंदाजा कर लीजिए कि ये कितना फेटल है।
Yeah.
बाकी देखिए बिल्कुल आपको प्रिकॉशन फ्लू लाइक इलनेस की तरह प्रेजेंटेशन इसकी फ्लू लाइक इलनेस जैसी है, बट आपको प्रिकॉशन ऐसे ही लेना है। आम लोगों को ये चीज समझ लेनी चाहिए कि ये समझ लें कि जैसे कि आपको अगर कोविड है तो आप क्या करेंगे। आप लोगों से दूर रहेंगे, आप अननेसेसरीली घर से बाहर निकलने का अवॉइड करेंगे, आप अपने आप को वेल हाइड्रेटेड रखेंगे। और डेफिनेटली इस वक्त जितना स्ट्रेस चल रहा है अक्रॉस द वर्ल्ड, हमें ये चीजें समझनी है। अदर देन दीज हम जो बात करते हैं न्यू नॉर्मल की, ऐसा लग रहा है कि अब ये
Yeah.
सब कुछ
Yeah.
न्यू नॉर्मल जा रहा है। और न्यू नॉर्मल,
Yeah.
आई वाज जस्ट रीडिंग अबाउट इट कि दिस टर्म वाज कॉइन्ड जब हमारा फाइनेंशियल क्राइसिस शुरू हुआ था 2003 में। तो न्यू नॉर्मल की तरफ जैसे हम प्रोग्रेस कर रहे हैं, हमें ये चीज समझनी है नॉट टू गेट disheartened. Again, the only thing that keeps us going ahead and positive is that hope and faith. So keep your hopes up, but keep strong faith that okay, we will pass ahead of it, we will get a treatment of it, we will get a vaccine soon. But every individual has to do his bit. Every individual, it's not just about the medicines and the CDC and the doctor's responsibility. Every individual is responsible. हर इंसान इस वक्त जिम्मेदारी ले कि अच्छा मेरी भी जिम्मेदारी है इस वक्त सोशली कोविड से बचने के लिए, तो प्रॉब्ली हम किसी तरह इसको कंटेन कर पाएंगे।
Yeah.
बाकी स्टे पॉजिटिव, कीप योर एनर्जीज हाई, आप सोशल डिस्टेंसिंग रखें लेकिन इमोशनली डिस्कनेक्ट नहीं हो, लोगों से कनेक्टेड रहें, and that will keep you moving ahead. I'm sure you need to stay positive,
Yeah.
you need to keep your energy high, you need to keep yourself healthy, and just keep going ahead. Have faith, keep going ahead positively.
If
Sama,
I
would
may,
you? Yeah. Yeah.
yeah, if
Go
I
ahead.
may add on to what Sana said and Ahmed Raza's question, कि टीबी की वजह से, टीबी की वैक्सीन की वजह से पाकिस्तानी कम्युनिटी बची हुई है, तो दैट्स अ बिग मिसकंसेप्शन। इस पे मैं ये एलैबोरेट करूंगी कि एक तो शुरू में हमारे पास टेस्टिंग ज्यादा नहीं हुई, तो हमारे पास नंबर्स नहीं आए। अब टेस्टिंग बढ़ना शुरू हो गई है, तो हमारे पास गवर्नमेंट के पास रजिस्टर्ड केसेस बढ़ रहे हैं। इसलिए मई के अंदर में आपको सबसे ज्यादा अपसर्ज मिल रहा है, और 8 मई को सबसे ज्यादा अपसर्ज था, विच वाज 1600 केसेस ऑन 8 मई। तो जितनी
Yeah.
टेस्टिंग कैपेसिटी बढ़ रही है उतने कोविड पॉजिटिव भी बढ़ रहे हैं। दूसरी चीज ये है कि आपकी पॉपुलेशन में बहुत सारे एसिम्टोमेटिक कोविड पॉजिटिव्स हैं, ठीक है, जो वो 14 दिन गुजार देंगे बीइंग कोविड पॉजिटिव, शोइंग नो क्लिनिकल सिम्टम्स, दे विल नॉट गेट टेस्टेड। सो ये बात कि बीसीजी की वैक्सीन से हम सेफ हैं और हमारे पास नंबर्स कम है पाकिस्तान में, दैट्स अ मिसनोमर।
Yeah. Yeah.
True.
True. Sama, do you face any? In fact, it's for all of you. Do you guys face any challenge in the ER when counseling the patient and the attendant handling the patient? of the COVID patient? I mean, of course, the attendance can't be there, but do you face any challenges while
Do
counseling?
you want me to start or
Yeah,
yeah?
sure. Yeah,
Yeah.
sure.
बिल्कुल challenges हैं. The main challenge is because what happens is if we are suspecting anyone COVID patients, so they go straight into the hot area of the emergency department, and that is a completely locked area. So for instance, with my emergency, it will be different in maybe in UK, probably in Sana City it will be different. So what we have done is we've got a completely different hot and cold areas. It doesn't mean like कि अगर cold area में कोई patient है या doctors हैं, even in cold areas the doctors are properly donned, they've got full PPEs, but we know that in hot areas they are all COVID patients or suspected COVID patients. So the challenge is we are getting very sick patients in hot recess, all those COVID patients, and we can't send the patient's relative in with them. But sometimes some of the patients they are getting very anxious about the patient and they want to see their relatives. So sometimes they are pressuring on us, they are forcing us. Sometimes they are getting very agitated because of that. Some of the patients we have to ventilate without getting the approval from the family because the family is on their way and we don't have time for that. So by the time they come up, the problem is all ventilated patients. The problem is it's 50% mortality rate even for all patients. So you can imagine how much with the COVID patient is worse for COVID patient. If you put them on a ventilator, the mortality is more than 50%. तो अगर किसी पेशेंट को आपने वेंटिलेटर पे डाल दिया इसका मतलब half the body you've lost already. So the problem is once they go into the ventilator and they go into the ITU, now they most of the time the news is most of the times I'm not saying every time it's a bad news and they haven't seen their relative for 4 weeks or 3 weeks and they don't know anything about what's happening in the world. The only time they get an information is from the nurse. So from my side this is the biggest challenge because we've seen patients getting agitated and I can imagine and I can understand the anxiety because if it was my relative obviously I would be that much anxious and I know that
Yeah,
if they're going on a ventilator I would probably not see them or something like that. So this is for me the biggest challenge.
yeah. Have you faced any challenge while counseling Sama in Pakistan?
Yes, of course, the challenges that Dr. Thakur mentioned, they're the same over here. Of course, the fear of knowing that their loved ones have COVID is, of course, something that we have to deal with. And फर्स्टली ऐसा पेशेंट अगर एडमिट हो भी जाता है तो सबसे पहली बात अगर वो उसी परेशानी में है कि उनका मरीज दाखिल हो गया और वो कोविड पॉजिटिव है तो कॉन्टैक्ट ट्रेसिंग हम करते हैं तो हम पूरी फैमिली की टेस्टिंग करते हैं वो इटसेल्फ एक प्रॉब्लम बन जाती है उनके लिए कि एक बंदा बीमार है और उनकी भी टेस्टिंग हो रही है for it and so to counsel them for testing is also difficult and again once these patients are admitted in the ward the attendants cannot visit because there are very strict rules and regulations about the COVID ward, and the attendants are not allowed to visit. And if the patient comes out after their admission, if they come out negative, go back healthy, that's good, that's great news. But in case the patient does die, तो वो भी एक बहुत difficult process है for attendants to because the body has to be wrapped in a particular way, the ambulance
Yeah,
has to be arranged, the funeral cannot be attended by a lot of people. People who attend the funeral have to be in PPEs.
they
So
must
it's a
be.
very psychologically hard-hitting trauma for the
Traumatizing.
attendants.
Mm.
Yeah, yeah, true. Um, Dr. Amir, I would like to ask your opinion about Islamic perspective about epidemics and pandemics that are there.
Yes, Huda, that's a very interesting question because we are all frontliners. Everyone who's working in the hospital, no matter whatever specialty, we are very prone to COVID-19. And it's not about people or patients getting the COVID. We are exposed to COVID. And I hope and pray that everybody stays safe. But we are at a very high risk. So we should know about the Islamic perspective in treating these patients. सबसे पहले तो जो है मैं थोड़ा सा क्वारंटीन का बता दूं कि 1400 years ago our prophet Muhammad sallallahu alaihi wasallam he taught us about the quarantine, because there is a hadith that says if there is a plague, if a plague breaks in a land, then don't leave that place because there's a risk
Yeah.
of infection. So जो भी, the second hadith, the continuation is, if you know about a plague that breaks in a land, then don't enter that land as well, because then you will be prone to the infection as well. So
Hmm.
this is an amazing thing, because this is a pandemic at the moment, because at that time it was mainly epidemic. Now the problem is, because we are traveling, it's very easy for us to travel all over the world. We've got planes and ships. Before 1400 years ago, there was no ships, or there may be ships or something, but it would take like years or months
There
for.
wasn't much traveling.
More
Yeah.
of
Yes.
transport.
The second thing was, there was someone came to meet the Prophet sallallahu alaihi wasallam, and in Medina, and he came to take bath from the Prophet sallallahu alaihi wasallam. So the Prophet came to know that he had a plague, and he refused to shake hand with him, knowing because he had a plague and it can cause disease to himself or any other person. So the Prophet asked him to leave the place, and his bath is accepted. So this is joy. This is exactly what the social distancing is telling us at the moment. So that's what
Yeah.
we are telling them. Don't shake hands. It's not that we don't want to shake hands. It's because it's a plague.
Yeah.
There are other. There are so many hadith about there was once one hadith from the Prophet Muhammad, that if you see a person with leprosy, just run away from that person, as you see the same way as you run away from a lion. So this was the thing about the social distancing and all those things. एक और चीज जो मैं मेंशन करना चाहता हूँ कि in this world, the world we are living in together at this moment, it will be like now, from now on, it will be the world before COVID and the world after COVID. And the world
Yeah.
before COVID, Muslims जो हैं इसमें we have been labeled as terrorists for unknown reasons. It's not that all the Muslims are terrorists. So we've got an opportunity. Allah has given us the opportunity. We should tell the world that we are taking care of these people, and especially the doctors. तो हमें तो अब इनकी ज़्यादा जो है लुक आफ्टर करनी चाहिए इन लोगों की. We should, it shouldn't be just like this is a part of a job, but this should be in keeping in line with the Muslim manners and behavior. So there are other lots of things, but this is just a general thing that I would like to tell all my fellow colleagues, that if something happens to us, if we get sick, just be patient, because there are numerous hadith about from the Prophet Muhammad sallallahu alaihi wasallam, that if we get sick or if we die in a pandemic or in an epidemic, we will get a status of a martyr. I'm not saying inshallah everybody will stay safe. Keep your
Yeah.
all your precautions, but this is just brief about the Islamic perspective.
Yeah. Thank you about answering that question. I think it was much needed. Sana, somebody asked a question about precautions that a pregnant females should take when, because especially who are about to deliver in the next upcoming months, what are the precautions that they should take?
So pregnant, even for pregnant females, they come into the vulnerable group, just like any elderly above 65 years of age or people who have multiple comorbidities. So that nothing other than these, we as pregnant women are vulnerable. They need to be cautious about, maintaining the social distancing thing and good exercise, hydration, try to maintain their health up to optimum. And yes, of course, there is a risk if somebody gets infected while being pregnant. Again, it depends on how COVID proceeds in them. And if a COVID infected pregnant woman delivers, then yes, there are still studies going on how would we, other than screening the children, the babies, how would we proceed further? How would they present further? I have not yet come across any case in which a delivered baby was also COVID positive. So yes, the pregnant for
But I
pregnant
think
women.
there was somebody mentioned that there was a chance of vertical transmission or something. Do you have any? Do you know of any stats that you have come across while reading literature?
I think,
No.
can I? add on,
Yeah.
there was a case of vertical transmission. I think about 3 or 4 weeks back, and it came in the headlines. Mom was COVID positive, and the child as well became COVID positive. This was about 3 to 4 weeks that came up in the newspaper. So there is a very minor chances of vertical transmission, but there is a chance of vertical transmission because that came up in the newspaper, and I'm not sure what exactly happened, but I've heard that the child and the mom both were fine.
Okay. All right.
Huda, just in continuation with what Dr. Amir said,
Right.
regardless of the religion, even Muslims, all in all, they say saving one human is saving mankind. So this is the message that we in the religion of Islam also have from the Holy Book Quran. So this is the message we follow up with. इसी के बेसिस पे हम कहेंगे कि सोशल या कल्चरल गैदरिंग्स या रिलीजियस गैदरिंग्स का प्लीज सब लोग ध्यान रखें, क्योंकि जिंदगी बचाना सिर्फ डॉक्टर का जिम्मेदारी नहीं है. इस वक्त कोविड की सिचुएशन में जिंदगी बचाना हर एक इंडिविजुअल की जिम्मेदारी है. वो इंसान जो मस्जिद जा रहा है, वो इंसान जो जुलूस में जा रहा है, वो इंसान जो किसी सोशल गैदरिंग में रमजान की पार्टी में जा रहा है, हम सब की इक्वल जिम्मेदारी है. हम सब रिस्पॉन्सिबल हैं अगर हम इस वक्त एक कंडुइट है इन्फेक्शन को स्प्रेड करने में.
Yeah. So, Sama, can you tell me about the stats as well as in Sindh per se about the number of COVID patients that you have that have been tested positive and the testing capacity development now? Has it gone up to?
Yeah, I think in the beginning of the meeting I did mention, but I'll mention them again. As of today, the 24,434 cases in Pakistan, and in 24 hours there has been 1,600 cases. And yesterday, as of May 8th, was the biggest surge of 1,600 cases since February. And we've had 618 deaths so far, which brings us to a mortality rate of 2.2%. And amongst the provinces, Punjab is topmost with 10,000 cases, and Sindh is following in lead with 9,600 cases. The testing abilities have increased. The government is providing the testing kits. The testing kits have come from China. So, as compared to before, the hospitals are testing more. So, when the tests increase, the COVID positive numbers will also increase. But what we need to do, if I may use this platform, is that all the hospitals that are not catering to COVID positive patients, if they have ventilators, there should be some legislation, some regulation that those ventilators should be brought in at this point to all those hospitals that are serving to COVID-19, because we need ventilated beds. डॉक्टर्स आपके पास हैं, पाकिस्तान में डॉक्टर्स हैं और वो मरीजों के इलाज के लिए भी तैयार हैं, प्रोवाइडेड उनको पीपीई मिले, हम मरीजों को का इलाज करने को तैयार है सारे, मगर हमें वो इंफ्रास्ट्रक्चर चाहिए. हमारे पास हॉस्पिटल्स में स्पेसेस नहीं है, हमारे पास वेंटिलेटेड बेड्स नहीं है, और ये मरीज वेंटिलेटर पे जाता है, जो खराब होता है वो वेंटिलेटर पे जाता है, वो आपकी हाई फ्लो नेजल ऑक्सीजन उसको पूरा नहीं करती, उसकी ऑक्सीजन रिक्वायरमेंट सीपैप नहीं पूरा कर पाता, पेशेंट वेंटिलेशन पे जाता है. हमें बाकी जो हॉस्पिटल्स हैं जिनके पास वेंटिलेटर्स हैं, जो कोरोना पेशेंट्स नहीं ले रहे हैं, प्लीज उन हॉस्पिटल्स को अपने वेंटिलेटर्स कुछ अरसे के लिए अतिया कर दें ताकि वो मैस पब्लिक को ट्रीटमेंट प्रोवाइड कर सकें. Because this is a dilemma that we are facing here right now in Pakistan. And if the numbers continue to rise, then we will have to, as doctors, take this decision कि किसका इलाज करें, किसको बस जाने दें, अल्लाह की मर्जी समझ के.
Yeah.
We don't want to come to that point, but we are slowly coming to that point, which is bringing a lot of anxiety amongst doctors.
Yeah. So we've talked about a lot of death and positive patients, but what percentage of patients have recovered in your facility?
Yeah, so as far as the stats that I have, I hope they are correct. So up till now, since February 2020, we've had 7,756 recoveries, which is 28.2% patients have recovered.
Okay, so that's a good start. I mean, amount
Yeah,
of the negativity that we have come across with patients dying, and there was a couple of there were a couple of cases that were being highlighted about a certain doctor that passed away because of apparently negligence or lack of information about availability of beds. And I think having a that high number of recovery patients is something that we should tell more often rather than dampening the effect of that. What are the numbers that you have seen in UK recovery wise? Any of you would like to answer? Dr. Amir, you'll have to unmute. I think you muted your mic.
Sorry, yeah. So I don't have the exact number about how many recoveries we've got, but there is a huge number of patients that have been recovered. Or according to one of the statistics, out of 10 patients who are admitted to the hospital, about I think seven or eight patients are discharged after being tested twice. So recovery has been also on the good side as well. So it's not about the bad things that are coming up with the COVID, that we've got 212,000 patients and we've got 31,000 deaths with that. So their recovery has been, lots of my friends like who are working in the emergency department, they have been COVID positive. They self isolated now. They're fine. Lots of my consultant colleagues, they have died as well. I know a few of my colleagues, two or three of my colleagues, they have recently passed away because they were on ventilators, and after that they haven't been unwell. But the thing is, lots of patients have been, I don't have the exact number at the moment, but still there's a huge number of patients who have recovered.
Okay. And you observed the same, Sana, right?
Hmm. See, other than the deaths, then it's mainly about the recovery. A large number of patients who are either having mild viral symptoms and are not even presenting to hospital are actually recovering. There's a very low threshold of unattended deaths per se. So patients do come to hospital if they're sick and they're ventilated. But yes, the survival rate from ventilated patients this is very low. Once somebody goes onto a ventilator, 76% chances of mortality. It's a very poor recovery chance of anybody going to ventilator. Otherwise, people who have the larger bit is almost 70 to 80% are those who are mildly infected or having mild symptoms, and they do recover.
Sama, have you? What about elective surgeries? Are you guys still doing elective surgeries at Indus, or have you delayed them?
so all elective procedures are postponed as of now, including the OPDs. At least in Indus, some private hospitals have started elective OPDs. Some major hospitals have as of yesterday. But at Indus, right now the elective OPDs are closed, and patients are being consulted through telemedicine. And if somebody really needs any sort of treatment or management, the patients are brought into the emergency. And as far as surgical follow-up patients are concerned, if they really need a follow-up, like an emergent follow-up, then they are brought to the emergency, and we call the relative team, the relevant team, and they come and visit the patient and tackle it from there. Surgeries are postponed. Only emergent surgeries are being conducted throughout all the specialities. And every patient that goes to the theatre here in Pakistan has to be tested for COVID before going into the theatre.
I just wanted to add one thing about the in
Okay, all
UK,
right.
as Sama has mentioned already, the surgeries and OPDs have been all postponed. Most of the surgeons have been diverted into other specialties. Like I know lots of my colleagues who've been orthopedic surgeons and different surgeons. They're working the ED, and we are asking them whatever they can do because the number of patients were ramped up with these patients. So even if they could do something which can help the ED, some are diverted to ITU, some are diverted to different specialities. So all the other specialties, which if there's no emergency operations or PDs that are needed, all those specialties have been diverted to other departments.
Okay. Sama, would you answer this question that we just got on Facebook? In Pakistan, what is the policy for retesting the patients who are critically sick and they recover? How many negative tests are required before the patients are discharged if they have successfully recovered, especially the ones from ventilator?
Well, we retest at 15 days after the first COVID.
Okay.
And if the patient is symptomatically well, before the discharge, the patient is tested, and the patient has to be tested negative before they leave the hospital premises. If the symptoms are not getting better, then of course the patient does stay in, because even if then the test is negative and the symptoms are there, then we do know that the PCR has a 50 to 75% sensitivity. So again, the retest has to be done. So the symptomatology and a negative test have to go hand in hand.
Okay. Somebody asked about infect transmission in children. So they live in a combined family, and they were asking about transmission in children. What is is there transmissibility ka bata dein if any one of you can answer, Sana?
Probably what they're talking about is the essential workers who need to go out on day-to-day basis, even today during lockdown. So their risk of
Yeah,
transmitting COVID if they are becoming carriers to their families. So yes, of course, there's always a risk. What you need to do from your part needs to be done. So once you come out, come back to your house. You need to take good shower, get your clothes to washing, and when you're going out of the house, if you can wear a surgical mask, yes, you can try maintaining 2 meter uh, distance between from your workstations where you're working as much as possible. Try avoiding gatherings, try avoiding a large group of people close in your office. So yes, these measures you need to do. And yes, risk is there. Of course, you may become a carrier, yet you may not have any symptoms. And once you are a carrier, you can even transmit COVID. But then again, it all depends on if in you, for example, this family is from Dubai. If in UAE they are testing the general population, then only you'll get to know if you already have been infected with COVID and you have antibodies to it or not.
yeah.
But until that time, just do the basic measures which are being told.
I just wanted to add one thing. Yesterday, there was a 6-week-old child who died in UK. This was very unfortunate, but the child had other comorbidities. He had congenital heart disease and other things. But this is just to mention that if you've got small children, most of us probably we do have small children, so we have to be extra cautious and just take the safety measures. But yes, it can affect the children, but the chances are very low in children. But it can affect the children.
All right. I think we have had a pretty decent conversation and input from all three guests. I'm sorry about the initial bit because there was a problem with the internet and everything. I would last ask everybody to at least give a few words give some closing remarks before we wrap it up. Just summarize what you want to say and what message you want to give. Sama, please.
Okay, for the Pakistani viewers, unfortunately, the numbers are going to rise. We are going to have a peak. And
Yeah.
regardless, the government does ease down the lockdown. You need to remember a few things. Number one, if you have elderly in the home, and if you are required to go to the hospital, or you really have to go to work, or you're exposed to to society outside, you need to maintain some distance from elderly, especially if they are sick, immunocompromised, 60 plus. Keep a safe distance from children in your house, especially the infants, the under 5 year age, because this is the end of the spectrum. They are the immunocompromised, most susceptible to diseases. Keep a safe distance from them. If you're going out because of whatever reason, please wear a mask. And if it do not and make sure that the people that you are working with in your business community, in your office, they're also wearing masks. So when two people are wearing surgical masks, the transmissibility of the disease is very less. Being in a compromised situation in Pakistan, because आपको बाहर जाना है, कमाना है, तो आप कम से कम ये करें कि आप खुद मास्क पहने, किसी पे छींके नहीं, किसी पे खांसे नहीं, एक डिस्टेंस मेंटेन करें और अपने हाथ सैनिटाइज करके रखें. And may God be with all of us. And there was one point we did not mention, and I think some people did ask about treatments. So all the treatments that are being given for COVID are all under trial. Some of them are giving positive results, but they're all clinical trials. Clinical trials are going on in Pakistan and all the major hospitals as well. We are giving patients steroids in hospitals in Pakistan in hope that it will decrease the inflammatory response in the lungs. There are conflicting studies about hydroxychloroquine because its effects at the lysosomal level. Some studies say it is effective, some say it's not, but it's being tried. Some people are recovering from it. Giving hydroxychloroquine with an antibiotic like azithromycin. Azithromycin has acts against the COVID-19, so a combination of HCQ and Azomax is also working, but again under trial. Giving IVIG, some people recover from it, some people don't. Giving tocilizumab, giving antivirals like remdesivir. They are being used in different hospitals, all again in trials all over the world. So it's the treatment for COVID is all trial and error. And unfortunately, that is how it is until we come up with a vaccine and the clinical trials all over the world give us something, give us a treatment protocol for this. But stay safe, everybody. That's all we can do.
Any closing remarks, Sana, Dr. Thakur?
I just wanted to thank you, Huda and Fahim, for creating this platform. So, closing remarks, may I think everybody knows about COVID-19, the social distancing. Everybody is told, so everybody knows about. So it's up. Everybody is responsible adults. They should think about themselves, what they need to do. But they are not just playing with their own life. They are playing with other lives if they are not following, especially their elderlies and other. The other thing is, I just wanted to, because of this platform, what you've, this is an amazing platform. I just wanted to ask my colleague if anyone wants to come to UK for a job, if they are interested in coming here, do let me know. I'll be more than happy to just fast track their application, make things easier for them. It's a bit difficult time at this moment because the job of like the recruitment is slow because of the COVID. But still, if anybody wants to come to UK, I'm on Facebook. So if anybody wants to contact me, I'll be more than happy to connect with them. Thank you.
Thank you. That's really nice of you.
Thank you,
Dr.
Huda, and thank you, Fahim. Yes, and it was a really good initiative to have these talks and have information about different parts of the world on how we are dealing with COVID. We are on common grounds as of now, saying yes, we are all aware of what COVID is and how infective it is. So, guys, just stay positive, try to stay healthy, please maintain social distance. It would take its own time to until we get a treatment, until we get a vaccine. As long as we don't get a vaccine, this thing is just going to extend. So kindly, please, guys, don't switch into just survival mode and stressed out. Just stay more resilient and stay positive. अपनी जिम्मेदारी जो हम सबकी है, please वो हम सबको करनी है, and let us do that. And yes, in the end, I would like to, though it should have been first, thank all my consultants, all my professors, all my teachers at ZMU. I feel so amazed when I'm working here at any platform. I feel so proud of my university, Ziauddin Medical University, and of course our professors. All salutes to each one of them, and blessings and duas for Dr. Irfan Ahmed Khan, Dr. Yaish, Dr. Professor Naeem Jafri, and yes, we all love you all. We are here because of you guys. Amazing mentors, our teachers, Dr. Zehra, Dr. Amir, Dr. Bazmi, and the list is on and on. Thank you very much. Thank you all.
Thank you. Thank you very much.